Welcome back. In today's session, we are going to continue with epidemiology of communicable diseases and start with the topic influenza. So you can see the picture here, and this is the children suffering with flu or influenza. The objectives to this session are the introduction to influenza, definition and history of influenza. Following, we will discuss about the epidemiological determinants to influenza, causative agent and types of influenza, the reservoir of infection, and also the source of infection, period of infectivity, host factor, environmental factor, what is the incubation period to influenza, the pathogenesis, signs and symptoms, differential diagnosis, complications, and lastly, the diagnosis and how we can prevent the influenza. So these can be a set of questions in front of us, and let us see by the end of the session will we be able to achieve all the objectives and define influenza, and we will tell the epidemiological determinants to it, the clinical features, DD, complications, and rest of the what it is mentioned above. Let us begin with introduction. So what is influenza? Influenza, commonly it is referred to as flu. What is influenza? Commonly flu. It is an infectious viral disease caused by RNA virus. So we see that influenza is an infectious disease. That is the reason it is coming under the communicable diseases. It is an infectious disease and it is caused by a virus. So it is a viral disease. Infectious viral disease caused by RNA virus. So we see it is a viral disease caused by RNA virus belonging to the family Orthomyxoviridae. So this virus, like how we come from the families, now this RNA virus is coming from what family? Orthomyxo. What is the family's name? Orthomyxoviridae family. The influenza virus. They affect the birds and the mammals. So these viruses which are coming from the Orthomyxoviridae family, they are affecting the birds and the mammals. Common symptoms in influenza are chills, fever, sore throat, muscle pain. So there is myalgia. Whenever there is fever, then there are common symptoms, right? Cold, fever, sore throat, muscle pain, severe headache, coughing, fatigue, general discomfort. So how can we remember this? First comes chill, followed by fever. Then sore throat, muscle pain, then you can remember fatigue, general discomfort. All these three together, and headache and coughing. Although confused with other influenza-like illnesses, especially like the common cold, we usually confuse what is the difference between this influenza and what is the difference between the common cold. How can we differentiate it? Influenza is comparatively more severe compared to the common cold. Common cold self-limiting and it is very milder form. It comes in a very milder form, whereas influenza we have severe headaches and the general discomfort. The fatigue is quite severe in cases of influenza. Moving further to the definition of influenza. The World Health Organization has defined influenza as a viral infection which is affecting the nose, throat, bronchi and occasionally the lungs. We see it is affecting the nose, the throat, okay, it is affecting the nose, throat, bronchi and rarely, very rarely the lungs get affected, okay. Lungs not very often. So the nose, throat, bronchi, nose, throat, bronchi and occasionally it is lungs. It is upper respiratory morely. more oftenly it is affecting the upper respiratory tract. So the nose, throat and bronchi is usually affected. Occasionally, sometimes the lungs can also be involved. Infection is usually lasting for about a week and it is characterized by, now we can list it. What is influenza characterized by? High fever, muscle ache, headache, malaise, non-productive cough, sore throat and rhinitis. So a new point we have come across is the rhinitis. Okay. We have cold, cough, sore throat, malaise, myalgia, headache, then high fever, etc. Clear. So we are very clear with the clinical features also. Moving further, we see the epidemiological determinants. This is very important. The agent factor, host factor, and environmental factor. From the view of the community medicine, the epidemiological determinants, the triad agent, host, and environmental factor is given a very important part in cases of SPM. From your exam point of view, you need to be very well aware of the epidemiological determinants in each of these sessions. What we are dealing, you need to be thorough with the epidemiological determinant. So what is the agent here? We've discussed the agent is a virus. It is a virus. What virus? It is the influenza virus. Influenza virus belonging to the family Orthomyxoviridae family. There are 3 viral subtypes. So under this influenza viruses, we have subtypes. So what are the subtypes? Type A, type B and type C. Okay, let us see. This influenza virus has 3 subtypes. Okay, 3 subtypes under it. Subtype A, B and C. Okay. These 3 viruses are antigenetically distinct. Now you see these 3 types A, B and C, they are antigenetically distinct. Okay, they are different from each other. Clearly, you can state the differences between those 3 types. There is no cross immunity between them. If a person is initially affected with A and he does not develop immunity against B in the near future, so he can be affected with C, he can be affected with B, he will have immunity only towards A. So there is no cross immunity between these influenza subtypes. Of importance is the influenza A and B viruses. So under this influenza viruses, the A and B are more important, comparatively more important, because they are responsible for the epidemics of the disease throughout the world. So the influenza type A and type B, A and B are causing the epidemics throughout the world. Both influenza A and B viruses have distinct surface antigens. Very important is the antigens. You can see there is a different distinct antigens between the influenza A and B. We have heme agglutinin H and neuraminidase N antigens. So there are 2 antigens, H and N. You can see here the influenza A viruses which have, here let us write down, okay, like this. So we have heme agglutinin antigen, and we have neuraminidase. Okay, you can see neuraminidase antigen, the green color one, neuraminidase antigen. H antigen, you can remember it as H and N. We are going to discuss about the subtypes in this. H and N, this is H antigen and this is the N antigen. Okay, fine. Heme agglutinin and neuraminidase antigens. The H antigen will initiate the infection following the attachment of the virus to the susceptible cell. So what is the function of this H antigen in the virus? So this is the structure of the virus, right? So we are seeing about the influenza. We are discussing about the influenza A virus. So this influenza A viruses is having 2 antigens. What are the 2 antigens which are present on the surface? H antigen and N antigen. What is the function of this H antigen? It is initiating the infection. You can see heme agglutinin H antigen is initiating the infection following its attachment to susceptible cell. So it will go attach to the required susceptible cell in the body. Whatever the viruses is going and attaching to the cell, that becomes a susceptible cell, and it will go attach and start the infection, that is H antigen. Now let us see what this N antigen does in the body. The N antigen is responsible for the release of the virus from the infected cell. I'll show you in the picture. See, heme agglutinin is allowing for the viral recognition, and the neuraminidase helps for the release of this viruses from the host cells. You can see the N antigen, what it is doing, it is releasing this virus from the infected cell into the body. Other cells it will start infecting. The N antigen is responsible for the release of the virus from one susceptible infected cell. The influenza A virus is unique among the viruses because it is subjected to various antigenic variations. The variations could be both major or it could be minor. So what are the things we studied so far? Let us not hurry with the things. The influenza A virus, we are discussing about influenza viruses. We have A, B and C, three subtypes. Under influenza A, we have two distinct antigens. What are the two antigens? Can you name them? They are H antigen and N antigen. Heme agglutinin, neuraminidase. What is the function of this H? It will go and attach to the susceptible cell. It is going and attaching itself to the susceptible cell. What does the N antigen do? The N antigen will cause the release of the virus from the infected cell. It is causing the release of the virus. So far it is very clear. Now let us see. Also this H and N antigen are subjected to various antigenic variations. They are subjected to antigenic variations. So these variations can be both major variation and it can also be minor variation. Okay, I guess I have to go to the previous slide. Yeah, when there is a sudden, complete or a major change, it is called as a shift. When the antigenic changes are occurring very gradually over a period of time, it is called drift. So now when we move on to the further slides, you will have a better clarity about the shift and the drift. So what is shift? Only thing you have to remember is shift. Shift when there is complete change, major change, and also it is very sudden. Suddenly shift. Okay, you can remember suddenly you shifted your home. So sudden shift completely. You don't do partial shifting, half things there. No, you're going to completely shift. You can remember what is an antigenic shift. When there is a complete change or a major change, then it is a shift. When the antigenic changes are occurring very gradually over a period of time, it is called as a drift. So, drifted gradually, slowly over a period of time, then it is a drift. So now let's see the next slide. We're discussing about the influenza C virus, which is antigenetically stable one. A and B, they are subjected to variations, antigenic variations. But whereas influenza C is antigenetically stable. Since the isolation of the virus A in 1933, the major antigenic changes have occurred twice. Now we are discussing about influenza A virus's antigenic variations. They have occurred once in 1957, that is H2N2, and again in 1968, H3N2. So these are the variations which have occurred. Okay. Strains occurring between 1946 and 57 have been called as H1N1 strains. The shift in 1968 is involving only the H antigen. Clear, guys? So we can see here, let us have a better clarity now. Let us start with H1N1. So you can see that the H1N1 was in 1946 to 57. We had 46 to 57. We had H1N1. From 57, we had H2N2. And then 68, we had H3, but the N2 didn't change. Okay, N2 remained the same. So only the changes were in the H antigen. Again, let me write it very clearly. These three antigens, let me zoom in and write. Yeah, fine. Okay. H1N1, H2N2, and then H3N2. N did not have any change. So what are the values what are the dates we saw? The year, it was 1946 to 1957, H2N2 1957, H3N3 68. Okay, 46 to 57, again 57, this is 68. Clear, guys? Now we are very clear about the strains. So let us read it again once. So let us start with H1N1. H strains occurring between 1946 to 57. 1957 have been called as H1N1 strains, and the shift in 1968 is involving only the H antigen. And here you can see H2N2 in 1957, H3N2 in 1968. In 1977, a new antigenic type appeared in China and also in USSR, and the virus was identified as influenza A H1N1. Within a year, it has been isolated in the countries all over the world. Okay. Moving further, that's about the history. You need to remember these three strains that will suffice. Let's move further. The prevailing A, H3N2, was not displaced. The dual infection with both viruses were reported. Again, we see that the H3N2, which was prevailing, it was not displaced. The dual infections started with both the viruses were now reported. As of now, three types of influenza viruses. What are those? H1N1, A, H3N2, and influenza B exist. Influenza viruses of the H1N1 subtype have caused the epidemics of the disease in the two periods of the century, in about 1946 up to 1957, and from 1977 until the present. So we've already discussed here in the previous slides all of this. So these H1N1 subtypes, they are causing the epidemics, and the dates, we are very clear about the dates. H1N1, when it comes up, you'll write 1946 to 1957. And the strain was seen in 1977 of H1N1. Until the present, it is continuing. It is causing dual infection as well, and it was seen in China and USSR. Okay, it is isolated in the countries all over the world. So you can see the structure of the viron here. It is having the polymerase complex, the lipid bilayer membrane, M1 protein, and the helical nucleocapsid RNA plus and NP protein, neuraminidase, and hemagglutinin. So you see the hemagglutinin having H1, H2, H3, and neuraminidase is having just N1 and N2. And how do we have the strains? H1N1, H2N2, H3N2. Clear, guys? Okay. Now, what is the difference between the influenza type A, B, and C virus? The host in influenza A are humans, pigs, horse, birds, and marine animals. Whereas in influenza B, it is only affecting the humans. The host are the humans. In influenza C, the host can be human as well as the pigs. So how do we remember? A are having a lot of host. Humans, pigs, horse, birds, marine animals. The epidemiology, influenza A is subjected to antigenic shift and antigenic drift. What is shift? Shift when there is a sudden change, okay? Sudden major change. Drift when the change, antigenic change or the antigenic variation is very gradual over a long period of time, then it is a drift. Influenza A is subjected to antigenic shift as well as drift. Influenza B is having antigenic drift only. C is also having drift only. What are the clinical features? It is causing pandemics with significant mortalities in affected young people. So it is causing pandemic. It is affecting all around the globe. Epidemic when it is crossing the continents, when it is crossing the borders, then we call it as a pandemic. Next, we see that influenza B is causing severe disease which is confined to the elderly people or the high risk people. Pandemics are not seen in cases of influenza B. Whereas influenza C is causing a milder disease. It is causing a milder disease commonly in the children without any seasonality. Usually influenza, flu, we come across people commonly telling they're having flu. So influenza C type, it is commonly seen in children without any seasonality, and it is a very milder one. The genome, 8 gene segments. Here we have 8 gene segments, whereas in influenza C we have 7 gene segments. Structure, 10 viral proteins. In influenza B, 11. In influenza C, we have 9. M2 is unique. This is NB unique and HEF unique. So, more importantly, these things, okay? The host, epidemiology, and the clinical features are important. You can remember these 3 things, okay, from your exam point of view. In your universities, this will suffice. Influenza A and B and C, how can we differentiate? Based upon the host, okay, based upon the host, and then the antigenic shifts and drifts, and the clinical features. Clinical features, what are the clinical features? Let us summarize them. A is causing a very significant deaths in the people, affecting the young people, causing pandemics. This does not cause the pandemics. It is affecting the elderly people and high risk people. A very milder disease, okay, no seasonality, very milder constant disease. Moving further to the reservoir of infection. It has become increasingly evident that the major reservoir of influenza viruses exists in the animals and birds. We saw it is existing in the horses, in pigs, birds, marine animals. Many influenza viruses have been isolated from a wide variety of animals and birds. Those are swines or pigs, horses, cats, dogs, domestic poultry, wild birds, etc. We also have domestic animals like cats and dogs, domestic poultries, and wild birds. Some of these is including the major H and N antigens which are related to human strains, and the reservoir of infection. Some of these strains are related to humans. Moving further to the sources of infection. The source of infection is a case or a subclinical case. So now we see how is this infection spreading. Who are the sources of the infection? They are the cases. Cases is an infection or a disease which occurs in the body, but it is having the noticeable symptoms in the patient. But a subclinical case is an infection which is affecting the body, but they are not having any noticeable symptoms. How do we differentiate between a case and a subclinical case? Subclinical, what does it mean? Clinical are the signs and symptoms. In subclinical, no signs and symptoms, no noticeable symptoms, whereas in the case, there are evident clinical symptoms. During epidemics, a large number of mild and asymptomatic infections will occur, which are playing an important role in the spread of infection. The cases usually will be treated. The cases usually will come to the hospitals, report, take the required treatment. But the subclinical cases, asymptomatic patients, mildly affected ones, they will not come, they will not report, they will roam around in the community, unaware, spreading the infection. The secretions of the respiratory tract are infective. Moving further to the period of infectivity, the virus is present in the nasopharynx a couple of days before and a couple of days after the onset of symptoms. So, the period of infectivity, how long is this person having the capacity to infect others? The virus will be present in the nasopharynx a couple of days. You can take it as 1 to 2 days before and 1 to 2 days after the onset of the symptoms. Moving further to the host factor, the influenza viruses will affect all the ages and both the sexes. In general, the attack rate is lower among the adults. The children are constituting an important role in the transmission of the chain. You can see they are forming an important link in the transmission of this influenza. And then the highest mortality rate is during an epidemic among the high risk groups in the population, such as old people. Who are these high risk groups? Old people, generally over 65 years of age, the infants under 18 months, and the person with diabetes, chronic heart diseases, immunocompromised people, like the people suffering with diabetes, chronic heart diseases, kidney and respiratory ailments. Let us summarize the influenza: age, all ages; sex, both the sex. Okay, age, all ages; sex, it is affecting both the sexes. And we see the high risk group, the mortality is in the high risk groups. Who are the people coming under the high risk group? Old age people above 65 years and infants less than 18 months. Okay, infants less than 18 months. And we have people, immunocompromised people who are suffering with chronic conditions like diabetes, chronic heart disease, kidney, respiratory ailments, etc. Human mobility plays an important role in the spread of the infection as well. Moving further to the immunity which is acquired with this influenza, antibodies will appear in the body about 7 days after an attack. And the antibodies will reach a maximum level in 2 weeks. After 8 to 12 months, antibodies level will drop to the pre-infection level. Can you see here what is happening? Once a person is infected with influenza, okay, the nose, the bronchi and rarely the lungs are involved, right? So if the person is infected with influenza virus, the antigen will enter the body and antibodies will fight against this antigen. So these antibodies will start appearing in the body within 7 days. In about 7 days, it will take up to 1 week, okay, 7 days for these antibodies to appear. And these antibodies will reach the peak maximum level in about 2 weeks. Okay, in 2 weeks it is reaching the maximum level. Then 8 to 12 months later, this antibodies level is dropping back to the pre-infection level. The antibody to the H is neutralizing the virus, whereas the antibody to the end is modifying the infection. It is modifying the infection. What is the function of these antibodies? The antibodies will be generated against this H antigen as well as N antigen. The antibody against the H antigen will neutralize the virus, whereas the N will modify the infected cells or the infection. Secondary antibodies will develop in the respiratory tract after the infection and they are IgG. So the secondary antibody is predominantly IgG. Antibodies must be present in the sufficient concentration at the superficial cells of the respiratory tract. So you will see that antibodies, they have to be present in the sufficient concentrations, especially at the site of virus invasion, that is the upper respiratory tract, the nasopharynx. Moving further to the environmental factors of influenza. Starting with the season. The seasonal incidence is striking, Epidemics are usually seen in cases of the winter months in the northern hemisphere, whereas in India, the epidemics have occurred also in summer. So we see that in this season, we have to remember it is the epidemics occurring in winter months, and in India, it is also seen in cases of summer seasons. In tropical countries, we can see the influenza virus will be circulating throughout the year with one or two peaks during the rainy season. And we can see in the northern hemisphere, it is occurring in the winter months, in the rainy seasons in the southern hemisphere. So, the northern hemisphere, southern hemisphere, it is occurring in the winter months and the rainy seasons. Moving further to the overcrowding. Overcrowding is enhancing the transmission. The attack rates are quite high in the close population groups. So, the close population groups could be the schools, the institutions, ships, where the population. The overcrowding is usually observed in schools and then institutions. In ships, the overcrowding is seen, and it is an environmental factor which is causing the spread of the infection. Moving further to the incubation period is about 18 to 72 hours, that is 1 to 3 days. We did not discuss about the mode of the transmission. The modes of transmission could be person to person or droplet infection. Okay, the mode of transmission after this. Okay, the mode of transmission of infection, it is from one person to another person, from person to person, by droplet infection. Okay, by droplet infection or droplet nuclei, which is created by sneezing, coughing, or talking. The portal of entry is the respiratory tract. Okay. Moving further to the pathogenesis as well as the clinical features, the virus will enter the respiratory tract. It will cause inflammation, necrosis of the superficial epithelium of the trachea and bronchial mucosa. Following, we have secondary bacterial invasion. There is no viremia. So, the virus is not entering the blood. It is just entering the respiratory tract. It is causing inflammation followed by necrosis. That is the death of the superficial epithelium of the trachea and bronchial mucosa. Clear, guys? Very simple. Inflammation followed by inflammation, there is necrosis. Followed by inflammation, there is necrosis of what? The trachea, the bronchi. The superficial epithelium is affected. Following, the secondary bacterial invasion can occur. Moving further to the signs and symptoms, symptoms will begin 1 to 4 days after the infection. Following symptoms of flu can vary depending upon the type of the virus, depending upon the person's age, if he's an elderly or the young person. So the signs and symptoms will depend on various factors, that is the person's age, the health status, and the type of the virus. General symptoms include the sudden onset of chills and fever 101 to 103 degree Fahrenheit, and we have chills, fever, muscle ache, sore throat, dry cough, fatigue, malaise, headache, diarrhea, dizziness, nausea, vomiting, etc. Both viruses cause the same symptoms. Fever will last from 1 to 5 days, averaging about 3 days in adults. Okay, 1 to 5 days on an average, 3 days is seen in cases of adults. The most dreaded complications in cases of influenza is the pneumonia, which should be suspected if the fever is persisting for 4 or 5 days, or if it is recurring abruptly after the convalescent stage. Again, the fever is abruptly occurring after the convalescent stage. Then we have to think about the dreaded complication like pneumonia. Okay, the new things what we studied, guys, the signs and symptoms we discussed about the fever, chills, muscle ache, fatigue, discomfort, the cough, diarrhea, dizziness, nausea, vomiting, diarrhea, and dizziness. Moving further to the differential diagnosis, the differential diagnosis to influenza is allergic rhinitis, upper respiratory tract infections, we have urticaria and COVID 19. What is the main difference between the cold and the flu? Cold is milder, flu is more severe. Fever rarely occurs in cases of cold, but in flu, high fever 101 to 103 degree is noted. Headaches are rarely seen in cases of cold, but flu has a prominent, very severe headache. General ache will be milder in cases of cold, but flu has the severe myalgia, muscle pain, etc. Fatigue is mild. Flu can last for 2 to 3 weeks. The fatigue can last if the person is affected with flu. Extreme exhaustion is absent in cases of cold. In flu, it is early. The exhaustion is early and it is prominent because in flu, we also have nausea, vomiting, clinical features. What did we see? We have nausea, vomiting, diarrhea. Which is causing the extreme exhaustion, which is quite early and prominent. The blocked nose is very common in cases of cold, but flu, it is occurring sometimes. Sneezing is usual, again in flu, it is occurring sometimes. And sore throat is very common in cases of cold and flu also, it occurs. General discomfort is quite mild, but in flu, it is prominently present. How can we remember the main points? Fever. Fever very rare in cold, but in flu it is very prominent. High fever 101 to 103 degrees Celsius. Headache is very severe in flu, and fatigue is prominent. Extreme exhaustion is seen. Moving further to the complications in the children, the studies show there is a link between the development of Reese syndrome and the use of aspirin for relieving fevers caused by the influenza virus. So we see that the person suffering with influenza subjected to various use of aspirin, prolonged use of aspirin to relieve the fevers, they are subjected to Reese syndrome. So in children, they have given aspirin tablet to reduce the fevers which are caused by the influenza viruses. So we see the influenza viruses which are causing the fever. To reduce the fever, they had given aspirin for a long period in children, and they are developing the Reese syndrome. So the Reese syndrome is involving the central nervous system and the liver in children, and the children are exhibiting the symptoms of the drowsiness, persistent vomiting, and change in the personality is also seen. So the children are also subjected to change in the personality. Because the central nervous system is involved here, so the personality also will be affected. So we can see it is affecting the liver, causing encephalopathy, and it is causing a liver damage following the use of the aspirin, which is causing the brain. In the brain, the central nervous system will be affected. It is causing the confusion, swelling in the brain, and it will cause the liver damage as well. Clear? That is about the Reese syndrome causing encephalopathy, and fulminant hepatitis can be there, encephalopathy can occur, and in the brain, cerebral edema causing behavioral changes and altered level of consciousness. Reese syndrome, there will be progressive encephalopathy with hepatic dysfunctions. Okay. There is persistent vomiting and also the change in the personality. Moving further to the diagnosis of influenza, we have to do the virus isolation. The nasopharyngeal secretions will be the best specimens for obtaining the viruses from the infected cells. The virus can be detected by the indirect fluorescence antibody technique. So first the viruses is isolated. The virus isolation is done from the nasopharyngeal secretions because they contain large quantities of the virus. Then the virus can be detected by the fluorescent antibody technique. The egg inoculation is required for virus isolation and antigenic analysis. Also, they are performing this egg inoculation for the virus isolation and also to analyze the antigens. They are doing the egg inoculation. The paired sera, a serodiagnosis of influenza A and B, can also be made by the examination of the serum specimens from the patient. One specimen will be taken as early as possible in the acute phase of the disease, not after fifth day. It is taken as early as possible, and the another specimen is taken 10 to 14 days after the onset, that is the convalescent stage of the illness. Is it clear, guys? The virus isolation is done from the nasopharyngeal secretions, and egg inoculation is required to study the antigens and the antigenic variations, and the antigenic analysis is done. So the egg inoculation is required. Whereas the paired sera, a paired sera for influenza A or B can be made. They are taking two serum specimens. One specimen will be taken in the acute phase of the disease, another specimen after 14 days. Okay, after the convalescent stage of the illness, after 14 days, when the infection has subsided, they are going to take another sera. The titri of influenza antibodies in the human sera is so variable that only by detecting a rise in the complement fixing antibodies during the course of the illness will diagnose the infection. So we see the antibody titri is going to be so high. Just by taking the complement fixing antibodies during the course of the illness, we can diagnose the case. Hence, the need of two specimens, fourfold or greater rise in titri, are considered the diagnostic of infection. So, we can see that the titri of influenza in the human sera will be so variable. Okay, it is very variable during the course of the illness. So, we take two specimens. Fourfold or greater rise in titri is the diagnostic of the infection. Rapid influenza tests are also performed. They are 70% accurate for determining if the patient is infected with influenza virus, and 90% it is accurate for determining the type of influenza. Rapid influenza tests are also providing the results within 24 hours. They can be performed in the physician's office as well. So the rapid influenza test, they are 70% accurate to determine if the patient is infected or not, and 90% accurate to determine the type. Okay. Moving further to the prevention of influenza. The only proven method for preventing the influenza is a yearly vaccination. A yearly vaccination approximately 2 weeks before the flu season is beginning. So, if the winter seasons are beginning in the northern states, we have to think about the influenza vaccination, which has to be done 2 weeks prior to the flu season beginning. And then the vaccine is trivalent, meaning that it is providing a resistance to the three strains of influenza virus, that is H1N1, H2N2, H3N2. The vaccine consists of two influenza A virus pathogens and one influenza B pathogen. So this vaccine is containing two influenza A virus pathogens and one influenza B pathogen. Since influenza vaccines will not control the epidemics, they are not recommended in certain select population groups. Okay, so we see it does not control epidemic. So we are just giving a certain group of populations. These vaccines are recommended only to certain population groups. They will not control the epidemic. Example, it is given in the overcrowded places like in industries to reduce the absenteeism, and in public services like the buses or overcrowded places. Okay, public services, to prevent the disruption of the critical public services such as the police, the fire protection people, transport and medical care. We are giving these vaccinations. Moreover, certain groups like the elderly, individuals in any group who have known to have the debilitating diseases, chronic diseases like heart, kidney, respiratory diseases, are selectively immunized because of the high risk of the severe complications like pneumonia can occur in them, including the death which can occur. Okay, so what are the high risk groups here? People who are suffering with chronic conditions, or the old age people, more than 65 years, infants less than 18 months, they can be immunized, and people in the overcrowded areas like industries to prevent the sickness absenteeism. We are giving these vaccinations, and critical public services, they are very much required. These public services have to be provided at any cost to the people. So critical public service rendering people like the police people, fire protection, transport, medical care, doctors, nurses, GNM, everybody. So those medical care, under medical care, all those professionals who fall under the medical care, they are provided the vaccines. And the influenza vaccines are a killed vaccine, we have live attenuated vaccine, and the new vaccines are split virus vaccine. The neuroimmunidase specific vaccine is also available, and we also have the recombinant vaccine. Killed vaccine, live vaccine, new vaccine like split virus vaccine, neuroimmunidase specific vaccine, and recombinant vaccine. How can we prevent the flu? By avoiding the close contact with the infected person. We need to avoid the close contact with the infected person. If the person is infected, he has to have a certain distance from others, and when he is sick, he can protect them from getting sick to his family members just by isolating, not having a very close contact with the other people. He can prevent the spread of the flu. Stay home when you are sick. So if possible, stay home from work. The school going children should be kept at home. Avoid sending them to schools and errands when we are sick. You will help prevent others from catching your illness if you stay home. Cover your mouth and nose. So, covering the mouth and nose with a tissue when the person is coughing or sneezing, this will prevent the spread of the aerosol and aerosols into the environment. The droplet infection, it is a droplet infections. So, we have to see that we cover our nose and mouth if we are infected with flu. If the infected person has to keep your hands clean, washing your hands often will help you to protect from the germs. And we have to avoid touching the eyes, nose, and the mouth. The infected person should avoid touching his eyes, nose, or the mouth, because the germs are often spread when the person is touching something that is contaminated with germs, and then he's touching his eyes, nose, or mouth. So just if a person who is infected sneezes and the droplets are on a particular object, and the other person took the object and used it, and later he rubbed his eyes, nose, so you have to avoid rubbing or touching your eyes, nose, or mouth. That is how it is spreading. Practice other good healthy habits like get plenty of water, sleep. Physical activity has to be maintained, and the stress levels have to be monitored. Drink plenty of fluid, stay hydrated, and eat nutritious food. Thanks for watching. With this, we come to a conclusion of the topic influenza. I hope it is clear. If you have any doubts, put them down in the comment section. And if you like the video, hit the like button and subscribe.